Hey everybody, organizing monster over here. Welcome to another episode of Union or Bust. It's a special episode, and who do we got here, Chris?
How's everyone doing? Chris Lopez, your union brother on TikTok, Instagram, all the platforms. Well, we do have some special guests. Well, we got Caroline O'Riordan from CalCare, Hollywood for CalCare,
Hi,
and you are the founder.
I
And
am.
we also have Max Cotterill,
Hey.
and from CNA, California Nurses Association. So if anyone knows about universal health care, it's probably the California Nurses Association. So why don't we start with you, Caroline? Tell us a little about yourself and your organization.
Yeah, hi. Thank you so much for having me on. Yeah, so I work in Hollywood. I've been working in television production writers' rooms for about 6 years. Started in 2018, and I've been a non-union assistant kind of, on TV shows where jobs will go for about, 8 months, 10 months, and I've been kind of hopping around from job to job. And obviously, there's been a pandemic and a strike last year. And so, healthcare, single payer healthcare has just been something that I've been passionate about since about, Bernie's 2016 run. So, I started this group called Hollywood for CalCare in summer of 2022 after just looking at the last CalCare bill that went through the legislature, or almost, kind of did, and just wanting to start the coalition in Hollywood, getting behind the bill for its reintroduction, which is coming in less than a month. February 16th is when the bill is going to be introduced. So just been trying to get a groundswell of support across the Hollywood unions with the ultimate goal of having, the big Hollywood unions, the DGA, SAG-AFTRA, the WGA, and the IATSE locals. We're hoping to get them to officially endorse CalCare. So that's kind of our pie in the sky goal of our group.
Well, that's
Yeah.
awesome. So, Max, tell us a little about yourself.
Yeah, so my name is Max. I'm a campaign lead and community organizer with the California Nurses Association. We represent over 100,000 nurses across the state of California. We're the largest union of bedside nurses in the state. We're also the largest state union affiliated with National Nurses United, which is the largest nurses union in the country. And CalCare and single payer is one of the core animating issues of our union. It's very simple. Nurses every single day have to go to work and try to care for people under a system that makes it impossible to do that. So, ever since National Nurses was United was founded in 2009, and even before then, CNA has placed the fight for single payer healthcare at the core of what we do.
Well, that's awesome. That's awesome. You know, in the labor movement, we support each other. We support other unions, and I think a lot of times we think about universal health care. I think you have to care about someone you don't know. You have to care about children that don't have health care. And I think about that all the time. And I think the nurses are for it. The nurses are in there. They're in the trenches dealing with everything's going on. So, it's a no-brainer. And then I heard about this Yale study. 450, I guess if we had universal health care, we'd save $450 billion a year, and we'd save 70,000 lives per year.
Yeah.
So, what is blocking? What is going on? What do you think? We sometimes we have elected officials. They campaign. They use universal health care as one of those carrots, dangling this carrot, and then all of a sudden they get into office, and then it's like they don't talk about it anymore.
Yeah. Absolutely. Well, I mean, I think you can start with the fact that our healthcare system is a for-profit system, right? It's dominated by healthcare corporations in the insurance industry, the hospital industry, pharmaceutical industry, and they make tons of money off of the way that the system is set up now. And so there is, just a lot of money being made and a lot of, inertia around keeping it that way. And so I think that's a huge, huge impediment to it.
And that's kind of what my goal is with Hollywood for CalCare, because Hollywood is just about the biggest spotlight you could, shine on something could come from a famous celebrity. Like, as, kind of ridiculous as it sounds, if we were to get some of these big lefty actors like, Mark Ruffalo or Susan Sarandon, or people who are, hitting the campaign trail for Bernie Sanders in 2016, 2020, the goal is for them to really get behind CalCare and shine a spotlight on it that is like so bright that these Democratic politicians who campaign on single payer year after year, but then when it comes time to vote for it, they come up with an excuse for why they can't. The idea is to get it just so universally supported that it's like an undeniable yes vote for them. Because as we've mentioned Governor Newsom, he really explicitly campaigned on support for single payer healthcare. There are photos of him with Bernie Sanders at California Nurses Association rallies, photos of him, videos of them saying, "Go Gavin, go, go Gavin, go." And he, promised to support single payer when he got into office, and he's been in office since 2018, and he has been essentially completely silent on the bill. So we really are trying to it's about forcing these people's hands, because they're not going to do it unless we shame them into doing it, because the campaign contributions from these pharmaceutical industries and insurance companies is what drives their campaigns.
Exactly.
Yeah.
Do you think, yeah, and our boy Gavin Newsom, we love Gavin over here. So I voted for his recall.
Shout out.
Just kidding. Shout out Gavin Newsom. No, I think he's gotten really unpopular with labor these past couple of years. Last year alone, he vetoed 2 labor bills, one for paying unemployment benefits to striking workers, straight up a union bill,
Yep.
and another one for autonomous vehicles having a driver in there, that's a Teamsters bill,
Yep.
and he vetoed both of them. So I don't think he's like the boy or the golden boy anymore that we thought he was going into the governorship. He's really shown the true colors of who he is. So do you think if this bill passes the House and the Assembly and gets to his desk, you really think he'd sign it?
I mean, I think so. And, it's one of those things where it's like, I think, we're going to get what we, are able to get, right? And what I mean by that is we're only going to get what we're able to organize for, right?
Right.
And so I would hope that at the point at which we have the power to get it through the legislature, that we also have the power to, hold him to his overt promises to pass single payer, under his term.
I think like the labor movement. When I think about universal health care, a lot of times when there's labor disputes or strikes, one of the things that this fear members, am I going to lose my health care? Am I, there's medications out there that people need to survive, and you take away that worry.
Yeah.
And unemployment benefits for striking workers, what is that, $450 a week? I mean, it's barely enough for food on the table.
I'm on
You
it right
vetoed
now.
that.
Yeah.
So,
Yeah.
definitely. Shout out Gavin Newsom.
I actually, just to that point, I am not a union member, but I was working as a non-union assistant in a writer's room when the strike started, and I lost my job. And a month later, I get my notice that I'm getting kicked off my health insurance. So, I mean, it really is, it's like black and white. It's a worker issue, as one of our goals really was to harness the energy of the strikes last year, because as we've seen over the past 3 or 4 years, I mean, the 2021 IATSE strike or near strike that happened in the fall of 2021, that was a huge galvanizing moment. I was working in production. I was a line producer's assistant. I don't know if you remember that Instagram account, IA Stories. It was like 170,000 followers, and it was all these anonymous submissions of crew members across our industry from every department writing in and sharing their anonymous stories about the backbreaking conditions of what it means to work in Hollywood. Never seeing your family, drug addiction, your body breaking down, your mind breaking down from how strenuous it is to work 12, 14, 16-hour days. And that was actually what really inspired me to get into this work, because I saw how we are all really collectively victimized by the working conditions of our industry, and that's repeatable across almost every industry in our state and in our country, but that it is possible for us all to really rally behind these strike moments where there's the threat of actually finally holding our bosses accountable for things. And so something we did last summer during the hot strike summer with the WJ and the SAG, where I got some funding from the California Nurses Association to go out every week and just have a little stand with refreshments, Gatorade, water, bananas, chips, and we just passed out these flyers, and we had conversations with, striking union, non-union members about CalCare, and just had so many conversations where you would hear people be like, I have one set of doctors for when I make my hours in the year, and then one set of doctors when I don't. It's like this issue touches every single union member, especially in Hollywood, because it's just so uncertain. We're seeing corporate mergers happening like every 6 months. Some new streaming service is like completely falling apart. Thousands of people are losing their jobs. It's just such a tenuous market, like everything is in America. It's also unstable by design, it feels like, a lot of times. So yeah, it's just this idea that healthcare is, people say in the WJ in particular, that's like the number one thing they like about being a union member, is like, it should not be your health insurance. It should be all the benefits it has to your creative, life and your work and working with other people in your profession. But instead, it's health insurance. It's just it's an issue that touches everybody's lives, and especially workers' lives. Yeah.
Yeah, I mean, it's definitely weird that healthcare is attached to employment.
Mm-hmm.
Yeah.
Like that's a weird thing. Like why would healthcare be attached to employment?
Yeah.
All the other industrialized countries in the world have some form of universal healthcare,
Yeah.
and they're able to afford it.
Mm-hmm.
We're the fifth largest economy here in California.
Yeah.
Mm-hmm.
Right, we have a supermajority in the House. By supermajority, I mean Dems.
Yeah.
In the House, the governor, and we still can't pass it.
Mm-hmm.
Yeah.
But I think it's kind of like the thing that we just talked about earlier with Gavin Newsom and people that fund these campaigns and relationships. I know I said I wasn't going to talk about it, but there are some unions that are against something like this.
Mm-hmm.
And they've told me like, oh yeah, Juan, that sounds great and all in theory, but like maybe then what would we tell workers when we're organizing them if they already got health care?
Yeah.
Like that's something that they dangle for these workers too.
Mm-hmm.
And then I tell this person like, it shouldn't be that way.
Mm-hmm.
We brag about labor bringing the 8-hour workday, overtime pay, child labor laws, Social Security benefits. Why can't we add another notch to our belt, which would be universal health care?
Yeah.
And then that's it. Because most of America, most workers are not in a union.
Mm-hmm.
So most workers do not have health care.
Yeah.
Even if you're in the union, you don't have health care. Like you mentioned earlier,
Yeah.
Hollywood unions, those members, talking to the president here from SAG, the SAG chapter in San Diego, he told me a lot of the actors don't have health care. They don't qualify for health care.
87% don't qualify.
Exactly.
Yeah.
Not all of them make that kind of money like Leonardo DiCaprio, let's just say.
Yeah.
I know that he's a big star, but not all of them make that kind of money.
The
to
minimum is
reach.
$26,000 a year. So that
And they don't
means-
make that.
Yeah. So that just shows how difficult it is to make a career in this industry and
Yeah.
to get your human rights met by your job, which is just,
I know, like in unions, we always support each other. I've been marching with if the nurses are on strike or another. We support each other. I might not know them, except like Nurse Maggie, who says big shout out. I see her on Instagram and My Pure Olives.
I would do shout outs.
And but what I was going to say, we're caring about people we don't know. We might not know their children, but we're there, we're supporting each other. And I think the labor movement, with that kind of message of solidarity, all of us like saying, hey, all children should have health care.
Yeah.
Everyone should have health care. So I just don't think people should worry about going to the doctor. And we were talking about before, Juan, COVID-19. That kind of proved the systemic problems that we have. Everybody's scrambling around with this pandemic, and it's like it's not our fault.
Yeah.
And people say, "Oh, I'm going to lose my quality health care," but yet, what if you're skiing and you're out of network and you break your leg?
Yep.
So it's like healthcare should be potable.
Mm-hmm.
Yeah,
Yeah.
we were just in Big Bear for my birthday 2 weeks ago.
Happy birthday.
Thanks.
Yeah.
And one of our friends ate it really bad,
Mm.
and then he he thought he broke his shoulder,
Oh
and
no.
we took him to urgent care. And the first thing that came to his mind was, "Damn, I wonder if I'm out of network.
Yeah.
Like, I wonder how this is gonna affect me. Am I
Yeah.
gonna be
Yeah.
able to pay for this?"
Yeah.
I'm like, "I don't know, man. Let's just go and see what happens."
Yeah.
And I'm sure they're gonna tell you it's gonna cost something before they do something.
Yeah.
But that's weird that that's the first thing that comes to his head. In an industrialized country, he's a
Yeah.
guy that has a really good job.
Mm-hmm.
We're just having fun, and accidents happen.
Yeah.
We don't plan for these things, but they just happen.
Mhm.
So that shouldn't be happening in
Yeah.
the richest country in the world and in the richest state
Yeah.
in the nation.
Absolutely. And it's ridiculous too, because not only are we the richest country on earth, but all of these other countries have figured out how to do this. A lot of them have single payer healthcare systems. And not only do they have, systems that are universal, cover everybody, but they pay like half as much for
Exactly.
healthcare as we do. So, going back to your other point, what an amazing opportunity for the labor movement to get another notch, right? To establish universal healthcare and then use our bargaining power on the next thing, right? To
Right,
fight for the next thing.
Pensions, something else.
Right.
And mental health right now.
Yeah.
It's like, is a big deal. People are looking at it more. And what's exacerbating the mental health crisis, I posted it on Twitter, is people don't have access to health care.
Mm-hmm.
I mean, what happens if you're battling alcoholism or anxiety or depression? Where do you go?
Mm-hmm.
It's like it's like there's no way out.
Yeah.
Yeah, and that is, these unions, everyone is talking about how every contract negotiation, it's like so many things are left on the bargaining table because of these skyrocketing healthcare costs, that as much as like these negotiators can try to work on getting those costs down, it's like it's going to cost what it's going to cost, and that price is dictated by these trillion-dollar insurance companies that serve like literally no purpose other than to deny care to patients so that they can reap taxpayer money, honestly. I mean, like it's criminal. They're like, it doesn't need to exist. It only exists because, someone said, I'm going to start a business and just come between you and your doctor and start, I don't know if you saw Cigna just got called out because they're literally using artificial intelligence to automatically deny patients,
Whoa.
like
Yep.
insurance claims. And it's happening, like thousands of claims a second are being denied. And it's because the insurance companies have figured out that if you initially deny a procedure or something that your doctor is prescribing you, it eventually you're just going to wear them down because the patient becomes so overwhelmed with trying to get through the bureaucracy, the administrative, nightmare that is dealing with your insurance company, that they're just going to give up and give you their money. And I want to just bring up a story about one of our founding members of Hollywood for CalCare. She's a WGA member. She's a writer, and she actually spoke on behalf of the WGA this summer on behalf of the bill SB 799 because the WGA got behind that unemployment benefits bill. So they were, sitting in legislative hearings, and Meredith Steam, the WGA president, was speaking on behalf of why unemployment benefits are so important to striking workers and to workers' rights. And our member Kayla was, speaking on behalf of the WGA, and she has a really just devastating indicting story about our health insurance system. She shared this before with CNA. She works with CNA as well. She in 2020 she was pregnant, and she had insurance through her husband's company. She wasn't in the WGA yet, and she went into emergency labor and had to give a emergency cesarean section, and her baby unfortunately did not survive. He was born. He was alive for 2 days, and during those 2 days, she had gone through a horrendous, traumatic medical emergency event. She started getting bills from the hospital and bills from the insurance company, and was all of a sudden in the middle of this insurance billing nightmare while she was suffering through the most devastating loss that you could ever imagine as a person, losing your child prematurely. And yeah, she still to this day, this was 4 years ago, 3 years ago, is still dealing with the medical bills that she had through insurance. She had insurance. She still ended up having to pay up to like $15,000. So it's like the insurance companies have no reason to exist. They will get in your most personal moments, and they will still tell you you owe us more money for some arbitrary reason. And I don't know, they pollute our lives with their bills and their negligence, and I don't know, they're evil.
I wanna actually relate what you're talking about with insurance to something that you said, which is the experience of COVID.
Yes.
Because during COVID, we had this moment where the pandemic came on, everything shut down, and millions of people lost their jobs, right?
Right.
And because we have a system in which most people get health insurance through their jobs, they also lost their health insurance. And so during COVID, what we actually saw is less people were going to the doctor, going to hospitals for like regular medical care. So even though we were in this pandemic, people were getting, receiving less, seeking and receiving less care. And what happened at the exact same time as a result of this is that every single insurance company posted the biggest profits they had ever posted. And it's a really important thing that we should talk about, because what that means is that the insurance companies did the best when people were not getting care. So at
Wow.
the center of our system, the companies that are supposed to pay for healthcare have this direct economic incentive to deny people healthcare because they get to keep that money. And that's at the core of how we pay for our healthcare system.
I wonder how many billionaires are in that industry.
Quite a few.
Yeah. No, I mean that's what it is. It's they're when you're applying for, or when you have an accident, the corporation or the insurance company's role is to deny you health care. That's like them winning, basically, like cutting labor costs kind of deal.
Yeah.
So that, no, trust me, like we're super supportive of this Medicare for all, universal health care. I know I got politically involved during 2016. I think a lot of people did,
Yeah.
with the Bernie campaign, and he brought to light like Medicare, like or the issue of healthcare. And no, a lot of people didn't know what it was, but by him speaking about it, it made it make sense. Like, yeah, why don't we have healthcare for us? All the other industrialized countries, isn't that they have it and we don't have it, blah blah blah, and then galvanized the whole country around Bernie. He almost won the primary. I went to Philadelphia for the convention,
Yeah.
and I was like, whoa, so he's making, and then people though, like the media, like painted it in a dark light, right? They painted him as the next Castro. He's gonna kill people down the, like he was like the worst of the worst. He was a communist and
Yeah.
this and that. But everybody's against this, not just these corporations, but also like the media and our political system. So we're dealing with like Goliath when we're trying to give everybody healthcare, which the one issue should be like, shouldn't this be a no-brainer, healthcare? We're not trying to give everybody like an iPhone or a laptop. It's like the basic necessity in life
Yeah.
to sustain it as healthcare.
Yeah.
So how do we turn this around though? Like even if we have 88% of Democrats
Yeah.
that support universal health care, and I think like 60 something percent of Republicans, so even the Republicans are on board.
Yeah.
How do you still get us to pass this in California?
Yeah. That's the $1 trillion question. But I mean, the thing that gives me a lot of hope is the fact that, there is actually quite a bit of labor support. You mentioned that not all unions support it, but almost all of them do. I think the problem is that most of them are in this kind of category of passive support, where they support it, but they don't quite see the path yet, so they're not willing to really throw down on it. But we're close, and we're only a catalyzing moment away from actually getting that moving, right? And there's, I think, a lot of reasons to be hopeful. In California, we've actually passed single payer twice in the 2000s, but then the governor vetoed it both times.
What?
So
Shout out Gavin Newsom.
shout
That's Arnold, right? You're talking about
yeah, Arnold,
Yeah.
yeah.
Oh, is that Arnold?
So we've done it before, and only since then the Democratic majorities in the legislature have gotten bigger, right? So there are the elements there. It's just figuring out how we get the dominoes kind of falling to actually get it done.
Yeah, and the last time just to say it, the last time it really made it to a floor vote was it passed the Senate. This was in 2017. So, if we can get it to the floor of either of these houses, the assembly it'll start in, we really do feel like we have the numbers this year. We have the Health Committee of the Assembly Chair and the Appropriations Committee Assembly Chair are former CalCare co-authors. So that gives us a lot of hope that that CalCare will get through the committees of the Assembly and then get to the floor. And, we have 62 out of 80 Assembly seats are Democrats, and it only needs 41 votes to pass. So it's on the universal single payer healthcare is on the California Democratic Party platform. So it's like, yeah.
People are having trouble paying their rent, paying their bills, cable, internet, whatever it is. People can't afford to pay for healthcare right now. There's just too much going on. I mean, think about it. And it just keeps going up. It's like, are we going to pay our rent, or are we going to go to the doctor?
Yeah.
That should not be a choice that someone has to make.
Yeah, absolutely.
Yeah. I think we touched up on this earlier, but I think universal healthcare will help with union organizing because it'll help unions. Because the way I look at it is, a worker doesn't have to have that in the back of their head. Like, I would go on strike, but I have healthcare with this employer, then I might lose my healthcare and whatnot. So I can't go on strike right now. So I'm sure, like, if we had universal healthcare, it'll help with union organizing because more workers would take that jump. More workers would go on strike and risk their job because they know they'll still have healthcare on the back end. Exactly. I heard that so many times. Because I'm a union organizer, so that's what I do is talk to workers, and one of the things that we always talk about is going on strike or withholding labor, or they might risk their job. One of the biggest things that they fear is to risk their jobs, which means they'll risk their health care, and then that's so backwards to me, like having health care tied to employment. And also on the negotiating table, we spend a lot of the time negotiating for healthcare, and then fighting for healthcare raises because over here Cigna or Kaiser is raising the rates on the back end, so we have to ask for more. They're telling us that they're going to raise our rates here with IATSE. 122 Kaiser. It's going to raise it around 20%. So that's what I'm saying. So now on the back end, we have to ask and negotiate for that. Otherwise, our members are going to have to pay out of pocket more. So it only makes sense for union organizing. It only makes sense for every person to be covered one way or another. But I think now is the time, though, to tie it into labor. Now is the time to tie it in for, like, this is good for labor, actually, because it's not, hey, I know some unions hold that chip over workers' heads, but like you said, you believe that most unions support this. I know my union does. We just got to come out and support and sign a letter. But if it gets sold in that way, like, hey, unions, this actually is going to help you organize. It's going to help you negotiate for better contracts. Then because labor, we say this on the podcast all the time, labor is hot right now. Everybody's looking towards labor because they're doing good. Look at UAW, Sean Fain. He's over here getting 30% wage increases for all of his members, doing like a revolution type of style, type of style of strike last year. And I would check out podcasts and they would criticize him. Like, oh, why would he do that? Why would he only strike certain plans? And then I would say things like, well, you don't know, he's probably strategizing his way into this. He knows what he's doing and he was successful. So why not listen to people like that? And that's why I think the country's looking at labor right now, because they're doing good. They're doing good for their members. So I think something like this, tying it into labor, is the way to go about it.
Also, there's just this like mask off happening, I think, with the ruling class right now, where while the WGA and SAG was on strike last year, you were seeing these conversations happening through the trades of Hollywood, where they were leaking out these quotes from these, Netflix CEOs basically saying, we want them to lose their homes. We're just, freezing them out or starving them out. We want them to get so desperate. Like, there is just this, the rich have never been richer and the middle class has never been so strapped down by how just the cost of living is impossible to maintain or get into the middle class now. And so I think, I don't want my employer having anything to do with my health care. It's just, it's this, it's like outrageous that we would want them to have anything to do with it, because it is a weapon. I mean, it's a weapon used by the ruling class against the working class, the poor. It keeps us in jobs that we get mistreated in. I mean, people say they don't leave. People don't leave abusive relationships because of healthcare. People don't leave abusive workplaces because of healthcare. It literally is a weapon used against us, and that is, I think, why there is such a ruling class, force that is keeping healthcare tied to employment, because it really is like the first domino that I think, not to get too radical, but it is like the first domino that could really fall to transform our entire country, is saying that, and that's why I think Bernie, so many people connected with him, where he said, like, this is like the linchpin. This is the thing that if you can change healthcare, if you can tell your boss that you can't own my body, then like the rest will come. Wages will rise, housing, like we can take everything back if we can take back healthcare from the most evil people on earth.
And I you kind of touched on it, but how important is social media in all this? Because I think about it. I always see the nurses. Nurses are, and they're all over that. I love watching the nurses on TikTok and Instagram.
Absolutely.
That before we had all these platforms, TikTok, Instagram, the message was controlled much more by the billionaires, by mainstream media. But now you have, the hottest labor podcast in San Diego.
Absolutely. Shout out.
Self-proclaimed.
But we have these platforms where people can talk about it, and our podcast is about solidarity, and the main thing is to keep the main thing, kitchen table economics.
Yep.
I mean, if people are having trouble paying their rent, people paying their bills, I go, we're all struggling here. We'll add healthcare onto that. It's like, take that off the table, have some ownership at your job, not worry about, like your boss. You're saying, why should my boss actually, you think about it, owning part of you?
Yeah.
I didn't think about that.
Yeah. To answer your question, I think social media is a big part of it, because exactly like you said, but prior to social media, everything was mediated through these huge news companies, right? And part of the promise of social media is that, really anybody can say anything, right? So there's that element of being able to jump over this traditional gatekeeper. So I think that's it's potentially powerful, and I think that, paired with the fact that, like I was saying, everybody understands our healthcare system is really messed up. That is ingredients for something really potent, right? If we can figure out how to put those together, it just catalyze people and really raise their expectations around this. I think that we could actually get something done.
Yeah, the number one reason why people go bankrupt is because medical costs.
Yep.
That's crazy. It's like
catastrophic accident.
Yeah.
Yeah.
Absolutely. Speaking of that, and my friend, we started posting this on social media, but he just had an accident I'm gonna say 2 weeks ago at this point.
Yeah.
He got ran over in the street. He was stopping traffic, and the car didn't see him.
Yeah.
And so he broke his spine up here. So he's paralyzed right now from the neck down. We've gone to go see him at the hospital.
Yeah.
But he's paralyzed now from the waist, from the neck down. He's like in critical condition. They've been doing surgeries on him.
Oh, wow.
But I know I've been talking to his wife every day, like texting her, checking in on them. But I'm thinking on the back end, like, what is this going to cost?
Yeah.
Like, he has good health care right now.
Yeah.
But what's going to happen afterwards?
Yeah.
Like, who knows if he is going to be paralyzed for the rest of his life?
Yeah.
What is that going to cost?
Yeah.
Is he going to have a nurse? Is he going to be on disability? And he just bought a house like a couple of years ago with kids.
Right.
So, but these are things that come to mind when these type of things happen, is like, damn, this is going to cost like over $1 million easily, if not more.
Yeah.
His whole life just changed. So it shouldn't be something that you have to worry about.
Exactly.
It's when an accident wasn't your fault. Like Chris says, COVID, we didn't anticipate that. We didn't ask for it. It just happens.
Yeah.
So that's why I'm like a staunch supporter of Medicare for All or CalCare. That's why I was a staunch supporter for Bernie Sanders, because to me, it makes sense. I'm like, wait, all these people don't have healthcare. I get it that if you're in the union, you probably have healthcare. but only 10% of America is unionized.
Yeah.
Right.
What about the 90% that's not unionized?
Right. Right.
And even if you're in a union, doesn't mean you have health care.
Mhm.
So that's why I'm like super like on it. But we have our own platform, we have
Yeah.
our own handles, and we can talk about these things and try to influence people on
Yeah.
it because we can. We don't give a shit.
Yeah.
Well, that's true. I mean, well, you think about it. It's like right now in social media. I see like elected officials blaming social media for
Yeah.
the mental health problems, and I'm thinking to myself, the reason we have mental health problem is people don't have access to health care.
Yeah.
People, but it's interesting. I think they fear what they can't control. The platforms.
Yeah.
They can't control Organizing Monster. They can't control your union brother. They can't control, so we want to get the word out because it's important that people understand it will save you money. And are you struggling right now with bills? I mean, seriously.
Yeah.
And just that any one of us could get hit by a car tomorrow. It's
Yeah.
like the people try to convince you that there's some sort of pull yourself up by your bootstraps aspect of healthcare, and it's just so not true. It's like you could be born with HIV, like you could be born with cancer, like there is literally no right or wrong or a hand of God, deeming one person is worthy of good health over someone else. It's like any one of us could end up in the hospital facing not billions, but millions of dollars worth of medical bills. And that is the aspect of like, you have to care about someone, like the other people in the state. You have to care about your fellow Americans. And that can be really hard to convince people to do because a lot of people don't care about things until it happens to them, unfortunately. Right. Like that, I think is definitely something that happens on, I don't know, in some communities, which is very unfortunate. But luckily, we have nurses. It's like no one knows better than a nurse about caring for others, and just the gift that it is to to take care of someone else's life and to fight for their right to live through a diagnosis, and to not lose their homes over it. And just one last statistic, it just came out like a few weeks ago that now officially over 50% of medical debt holders in the US have health insurance. So it's like, it's not just people without health insurance getting hit by a bus and being hundreds of thousands of dollars in debt. It's people who are paying copays, who are paying premiums and have deductibles, and their insurance companies are just denying things that they need, or not fully covering the care that they need.
Yeah.
I do think that people support this. People support it. I said it. 88% of Dems and 60-something Republicans. Percent Republicans support it.
Yeah.
Bernie almost won the primary in the Dem party, and that was 8 years ago. I don't even know how many years at this point, but it was a while ago. And he ran mainly on Medicare for all, and he supports it. So it's not the people, I think, at this point. I think it's the people on top.
Yeah.
Right.
It's the people that call the shots.
Yeah.
But I think they're starting to, I think this is the time. Like you, in your email you sent me, you're like, this is the time to pass this.
Yeah.
I think it is. If there's any other time, now is the time to pass this because of all the strikes that have been going on, all the spotlighting of our messed up system that we have. Everybody's starting to realize, like, no, the system is super rigged against us. And we don't need all these wars. Like, we can pay for all these wars forever, but we can't pay for health care for the people that live here in the U.S.
Yeah.
So definitely. Do you have anything else, Chris? I was going to say, those are all the questions that I had. Do you all have any last things that you want to throw in there, or how do we support, or what's the next plan to get this passed?
Yeah. I'll just say, now is a really, really exciting time in this movement because we are just preparing to introduce CalCare into the state assembly. It's going to happen in just a few weeks, probably the first week of February. So things are really, really starting to heat up. Probably the easiest way for folks to get involved would be to just sign our petition, CalCare, petition.org. From there, you'll be on the campaign email list, and we have tons of ways to take action. For those of you who are in labor, there's resolutions you can pass in your union. You can do organizing in your district. We'll do presentations to your union. We have legislative visits with members of the legislature. We're doing tons of different organizing, and now it's really kind of heating up. So now is a great time to get involved.
Awesome. I always say in the labor movement, We don't allow the billionaires or millionaires to dictate our wages, our benefits, or our working conditions. We deserve a say in the decision-making process, and I think that's exactly what CalCare is. So that's it.
Yeah, and just to reiterate that there is actually a precedent of support across the Hollywood unions for CalCare and single payer federally. IATSE has been a sponsoring, endorsing org on Pramila Jayapal's federal Medicare for All bills of 2019, 2021, and 2023. So that's the federal bill, but then also IATSE Locals 44 in Los Angeles, 44, which is like set deck, 871, which is coordinators, script supervisors, and 892/829 are the customers. All of those IATSE locals endorsed and were part of a Labor United for Universal Healthcare Coalition for the 2017 bill, SB 562. There also is Actors Equity, which is more, I think, based in New York, but they are a proud supporter of the federal Medicare for All bills as well. And right now we're kind of focusing our efforts on the WGA because, we did see, that's kind of we have a lot of members in the WGA in Hollywood for CalCare, and we just saw that their strategy of like hardcore pro worker messaging is really what was able to win them so many gains last year. And we have about like 70 petition signatures of WGA members. We're going to be presenting the WGA board of directors with our petition and just collecting petition signatures and testimonials. We have all these WGA members, people who are literally like, I won a WGA award in 2023. And because of the strikes, got kicked off my WGA insurance, and I'm on Medi-Cal now, and I can't get the care that I need from, all these issues that I have. So, that's the effort that we're really focusing on the next couple months is trying to get the WGA to endorse CalCare, and just hoping to get these unions not just to endorse and become, another organization on CNA's 100 plus, organization supporting list, but to really be out in the field, in your workplaces, and even going to the legislature and speaking with the California Nurses Association on behalf of their unions and their members. Just being vocal and supportive and coalition building is what we're really trying to continue this year. Yeah.
Well, there you go. All right, everybody. Well, that's another episode of Union or Bust. Thank you for watching, and please support Hollywood for CalCare, and we'll drop the link.
Yep. All right.
Thank you so
Thanks
much
for having
having
us.
us.
Boom.
All right.